And welcome back. A spike in mental health challenges among children and adolescents led the American Academy of Pediatrics to declare it a national emergency. Young people in child welfare are particularly vulnerable. Up to 80% of children in foster care have significant mental health concerns. JCCA provides services and support for children and families involved in the child welfare system, including programs throughout the Bronx. Joining us now and sharing more details, we are pleased to have the CEO and Executive Director of JCCA, Ron Richter, with us. And Ron, thank you so much for joining us, and a pleasure having you.
Well, it's great to be here, especially talking about this really important topic.
Yeah. So, for someone who maybe not be familiar, we hear the word JCCA. Give us a little bit more insight into JCCA as an organization.
Sure. So JCCA is celebrating its 200th anniversary this year, providing mental health, education, and child welfare services to New Yorkers. We do an enormous amount of work in the Bronx, and we try very hard to support families that have children struggling with mental health issues, and we provide those services at home. So we serve between 16 and 17,000 New York families a year. And we do that by offering mental health supports, including social workers, right there at people's kitchen tables so that people don't have to go out and about looking for services, but in fact can get those services right there in their homes. And our goal is to really work with families to support their children, not just with typical therapeutic services, but with life skills training for young people and respite for parents so that families can become stable again once they have real challenges presented to them. And we've been doing this, as I said again, for 200 years. So we're all about innovation and we're all about really trying to help families get back on track when they've hit hurdles.
Yeah. Mental health challenges are on the rise. And when we talk about our young people, particularly children, we see that number, as I said at the beginning of the segment, to be plateauing upward or hitting an upward plateau. Talk to me about where you see things at, and what are some of the big challenges that maybe we're not paying attention to?
Sure. So I think one of the biggest question marks, it's an excellent question, is the impact of the pandemic. And we really only know the tip of the iceberg with respect to what all of the social isolation means for kids. And as you know, children like my own 12-year-old spent significant amount of time alone and often on screens. And especially for younger children who are so dependent on socialization, children like 2 and 3 and 4 year olds were really limited in how much they got to interact with other kids. And now that we're coming out of the pandemic, we really are curious about how much that isolation impacts the way that kids go about getting on with each other and getting on with adults. Because kids were really cloistered. They had only their parents, and some kids only have one parent. And remember, those parents were stressed out also. So the question that you're asking, we really don't have the final answer on. We're learning more, but clearly this mental health crisis among children, especially foster children who were moved around quite a bit and not even seeing their own families during the pandemic, has created a real challenge with respect to mental health. And we are very concerned that schools make available as much as possible screening so that we know what our state of affairs is in terms of our littlest kids and our adolescents.
Yeah, I want to stay on the word challenge, Ron. And when we talk about challenge, I know that young people in the foster care system had a lot to contend with, particularly during COVID. Give us a little bit more insight into young people in the foster care system and how you've seen them be able to navigate.
Yeah, so I will say that one of the silver linings is the advent of telehealth. So the ability to access treatment and therapy through kids' mobile devices. And especially with teenagers, we found that they are often, reluctant to come into an office to get mental health treatment. And as a former lawyer for kids and as the parent of a 12-year-old, I can tell you that kids think that if they have to go see a therapist, they're crazy. And they'll often say to me, "I'm not crazy. I don't need to go see anybody." But often, if you give them the ability to zoom into a group session with other kids like them, they'll realize that nobody thinks they're crazy, but they need an outlet, facilitation with a mental health professional to talk through what's going on in their lives, what it meant to be all alone for a couple of years, trying to learn and grow up as a young person. And so telehealth really helped us get kids talking to one another and to a therapist. And for many teenagers, group work is very important. So encouraging our young people to work in models that make them feel good with their peers. So it's challenging, but if we have the right funding and if we had enough therapists, which are real challenges these days, I think that for foster kids, especially, knowing that there are others like them out there struggling is a real critical piece of solving the problems.
Yeah. You talk about your organization and more than 200 years, right? Where here we are looking at the work and the impact that's been done in the community. But we know that you can't do it by yourself. You rely a lot from help from government. Talk to us about where we are right now because we know the stock market is volatile. We know the economy is questionable. And when it comes to budgets in the city, the state, and the federal, things are being cut right and left. Talk to me about how you're navigating and what's going on there.
So I will say that the biggest challenge right now is hiring workforce that are quality people who really want to commit to helping our most vulnerable young people and families. And while Governor Hochul's budget promises to be better than we've seen in years, um, the infusion of dollars into mental health is so far behind the amount of money we've put into physical health over the last decades that we have too much catching up to do, frankly. That government has done some improving very recently, but we're competing in a very different work environment. Remember, this is an employee's market. And so finding people who, for example, want to work with our young people and families, who want to work with the most challenged young people struggling with really serious issues, compared to those people who want to work with low level anxiety in the suburbs through telehealth. Well, a lot of people want to work with the easier cases. A lot of people shy away from the most difficult, highest, what we call acuity, highest challenging cases. And so, even though there's been a little bit more money put into children's mental health, it really isn't enough. So we need to continue bringing to the attention of everyone in New York and beyond that investing in children's mental health is going to reduce costs later on. If we can help young people and their families now, then you're going to have a lot more school success. You're going to have a lot healthier people in the future, less diabetes, less heart disease, less cancer. This is all you have to do is go Google Adverse Childhood Experience Survey, ACEs, and you will see the proof that science shows invest in healthy children emotionally, and you will have healthy adults.
As a lot of our attention continues to talk about what's happened in Buffalo. You saw what's happened in Texas. You've got 18-year-olds. You've got young men who grow up and do these heinous crimes. A lot of conversation continues to be had about mental health and mental wellness. And it's almost like if you don't get in early, you really are setting the stage for really some possible devastating things in the future.
So, that disconnect has really we haven't figured it out, right? In other words, how many examples do you need of these young people who are obviously struggling with some very profound inner turmoil that leads, in the case of this kid in Texas, to kill his grandmother before he went on to just torturously kill these beautiful young children. And you're left to wonder, something really bad must have happened to this kid early on in his life for him to have ended up as a murderer, an assassin, frankly, if what is alleged is true. And so it does beg the question: what kind of screenings are we making available? How are we ascertaining for our young people what's going on? Because the fact is mental health is complicated. People don't walk around, with a broken arm or with fever or with other telltale signs of illness when it's emotional or mental health. It is never going to be that easy, right? People need to be screened. People need to have services available in a way that they can easily and confidentially access them. Kids don't want to talk to their parents about what's going on. It's complicated.
Right.
And we have to get more and more comfortable with being able to self identify and access services confidentially. And that's why telehealth could be such a great opportunity in schools, and sometimes school might be the touch point, but then kids might want to engage in treatment privately through a telefunction. And of course, parents have to be involved, but getting the kid into some sort of treatment, maybe by self-identification, is a place to start.
Yeah.
But yeah, go ahead.
No, it's a larger conversation that we have to have. I'm out of time on this segment, Ron, but thank you for giving us that which we need. And as we look forward to moving and having this conversation, we'll take a look and see where the issue of mental wellness and whether or not the dollars actually follow. We'll continue to follow. But Ron, thank you so much for what you do.
I really appreciate your time. Thank you, sir.
All righty. Now, for more information, you can visit their website at jccany.org and follow them on social media at jccany. We encourage you, don't go anywhere. We'll be back with more Open. We return right after this.